In 1985, our service club was asked to build a ramp for a neighbor needing easier access into her home. Very sporadically during the next few years, other people contacted us based on word of mouth conversations about our work and asked us to build ramps for them. We learned that many low-income people in need of a ramp were unable to obtain one because of lack of affordable options. At first, we explored what alternatives were available for people living in Dallas County only. We discovered that there were no good options available for this population. We knew that something must be done. We then started seeking sources of funding, talking to hospital and rehab center personnel, and gaining information we needed to better understand the problem. We recruited more volunteers to construct the ramps and located storage space for our lumber. Over the course of several years, we were able to go from building one ramp every 3 months or so to building 25 ramps per month. The Texas Ramp Project is an outgrowth of our first project in Dallas and was organized as a 501c3 nonprofit in 2006. We seek to provide free wheelchair ramps to low-income disabled and elderly residents across Texas. Currently, we have regional building projects in 17 different areas of the state. Our goal is to cover every county in Texas with one of these projects. Our principal need is funding so that we can buy the lumber to build ramps for the clients who have been referred to us. At present, we have about 2,000 ramps in backlog, even though we've already built more than 2,100 ramps. If we don't have the funds to buy the lumber, we can't move forward with this project because we will not spend funds that we don't have. Construction delays cause our volunteers to lose momentum and prevent us from keeping our commitments to the people we service. We know that the need for ramps is growing each year because we are steadily being contacted by organizations located all across Texas requesting our help. Your donation will allow this project to continue moving forward, providing practical help to individuals who are in need of our assistance. There are 3 factors needed to successfully build every ramp. First, we need to have a skilled team leader on site to lead the building project. Second, we need 4 to 6 unskilled volunteers to support the team leader. And lastly, we need the funds to purchase the lumber for the ramps being built in each region. So far, locating unskilled workers has been the easiest part for us. If we build at predictable times, like the 3rd Saturday of each month, we can schedule them months in advance. Plus, Texas Ramp Project provides volunteers with all the tools necessary to successfully build ramps in each region. Finding skilled team leaders, on the other hand, has been a difficult task because we need people who can amicably lead a group of strangers through project completion. These leaders don't need to be carpenters. We can teach them the building skills, but they need to be people who work well with others while also meeting project deadlines. The funding becomes an issue for us when we do not have a reliable cash flow to carry each project through the year. This is complicated by the fact that most of our funding sources are dedicated to us to use within a certain geographic area. This prevents us from using the money elsewhere, even in an adjacent county. Ultimately, we will need to identify enough regional funding sources to support each regional project, but we're not there yet. Lack of adequate funding is definitely limiting what we can do now. We're a very lean organization with many years' experience in what we do, and we attract very committed volunteers to our cause. Each regional project we commit to becomes most effective when the regional leader and his or her team accept the project as their own and start to function more independently of the Texas Ramp Project headquarters. We essentially try to handle all of the paperwork involved in a project and let our regional workers focus on the building of ramps. We do everything we can to simplify their task. Our project sites are very happy places to work because our volunteers can see that they make a difference in the lives of our clients and their caregivers. After only half a day of labor, someone will come down that ramp in a wheelchair or with a walker, happy for the independence the ramp provides them. Seeing immediate results of their work makes it a very rewarding experience for each volunteer on a project. The Texas Ramp Project is successful because of the number of skilled team leaders we have available in each region. The more we have, the better our process works. Second, adequate funding allows us to provide a steady supply of lumber to each regional project. Predictable scheduling is a key metric because it allows our volunteers to plan ahead and participate when they know what days they will be building every month. Unpredictable scheduling makes it very difficult for us to build a large volunteer base. Finally, we need to collaborate with the medical communities in each region so that we have a steady flow of referrals. The need for our services exists in every county in America. We just need to find a better way to connect our services with the people who need them. Many people think that we're funded by federal grants or that adequate funding is available to us to use as needed. In truth, our Achilles heel is the fact that our funding comes with such geographic limits that it does not allow us to be as flexible as we would like to be. We are working to change this by seeking more individual donors that will fund us annually and allow us discretion to use their donation funds where needed. We have well-funded regions joining regions with tenuous funding. That means that our clients needing ramps may be denied access because of which side of the county line they live on. Ironing out this wrinkle is crucial to our efforts to provide much-needed ramps to as many people as we can who live throughout our project regions. Our production rate has steadily grown since the inception of the Texas Ramp Project. In just a few short years, we've installed over 2,100 ramps totaling more than 10 miles in length. We started with 5 regional projects in 2006, and we've more than tripled that number to date. We've received more than $1.1 million in grants and donations to date, and our volunteers have given over 70,000 hours, valued at $1.4 million. We have more than 1,000 volunteers across the state and more than a dozen donated warehouses for storing materials and building modules. We have contracts with a number of area agencies on aging and work with other health service agencies. Now, at statewide conferences, people ask us, "When will you come to our area?" We tell them we want to come and will come when we have adequate resources to do so. We will succeed in meeting the needs of low-income people in need of ramps for their homes. The only question is, how long will it take us to get there? For more information about our organization, including all of our financial data, please visit our website at texasramps.org. We are now at a tipping point. We've worked extremely hard to broaden the scope of the Texas Ramp Project to include a large number of regions with a number of building projects, but we have reached full capacity with our current resources. Some of us have dedicated a significant portion of our lives to bring the Texas Ramp Project to this point, where our system is streamlined and we have tremendous credibility as an organization. Soon we will need to bring on board a new executive director and increase the number of people on our board of directors. We have successfully grown with deeply committed volunteers, a large number of community partnerships, and the support of our funding sources. To do what we need to be doing as we grow will require more leadership from members with wider skill sets, allowing us to continue to operate within a tight financial structure. With additional resources, we would increase the number of project leaders so that each region would have its own dedicated person to train volunteers, seek more regional funding, and stabilize the overall project. We would update our database to ensure that we are working as efficiently as possible. In fact, we need to update all of our communication systems. For instance, we need to create a new website where our partners, workers, and volunteers can access important information. We also need to develop our marketing program. Currently, there are many public relations and outreach tools we could be using, but lack the funds to do so. We want to incorporate more promotional materials, like creating yard signs with our logo and those of key donors when we are on site building a ramp. We want to issue t-shirts, hats, and other items to promote our brand and more broadly market our service. We would like to hold regional conferences to bring together our key volunteers, our primary donors, and partnering agencies that provide our referrals to us. Our long-term goal is to develop a statewide conference. A lack of adequate funding has limited our ability to expand as rapidly as we would like to. Gaps that we want to fill are to expand our services for our clients to include door widening and installation of grab bars in bathrooms. We're so overloaded with ramp requests that we don't have the time or resources to address these collateral needs, but they often go hand in hand with the need for a ramp as people navigate the challenges associated with using wheelchairs and walkers. Texas Ramp Project has been a grassroots level nonprofit so far, but we are ready to broaden our work by partnering with vendors like Home Depot and Lowe's. We also need to broaden our partnerships beyond Texas by contacting civic organizations like the Rotary, Lions, and Kiwanis, and church denominations that function nationally. This increased exposure would raise the stature of our work significantly and effectively extend our client base, allowing needy, low-income people with disabilities the resources they need to independently access their homes. We've been asked to facilitate the creation of ramp projects in other states, but the demands upon the existing workforce make this difficult. We want to build similar projects in other states that would benefit so many individuals who are in need of our services.